Health, finances, a roof over their heads. Just a handful of the needs that concern aging Canadians. Needs that many feel aren't being dealt with in this current election campaign. Joining us now for more, in New York, Amy Go, Executive Director of the Yi Hong Center. In our nation's capital, Michael Wolfson, Professor of Epidemiology at the University of Ottawa. And with us here in studio, Dr. Cindy Forbes, President of the Canadian Medical Association, Dennis Timbrell, former Ontario Cabinet Minister, and Adina LeBeau, Chair of CARP's Toronto chapter. And it's great to have our guests on the line from Points Beyond and here in our studio tonight. I want to start by asking each of you what the one thing that isn't being discussed in this election campaign that you think really should be discussed and it's really ticking you off. So let's start there. Amy Go, why don't you get us started in New York?
Sure. I think there is no discussion around health care, but more particularly, there is no discussion around senior care. We all know that there is an aging population that is actually, upon us right now, but there is no bold vision about a wellness model that would be focusing on health and prevention and, of course, support for not only the aging population, but for all Canadians. And I don't think there is any discussion at all at this election time.
Okay.
And I just want to also premise by saying that I'm speaking on behalf of myself and not on behalf of Yi Hong Center.
I understand that, and we should also add that your sister Avi Go was on this program recently, and not only that, you're actually from Markham. You happen to be in New York, but I don't want people to think that we've got somebody from the United States on the show commenting on our election. You're from here. Okay, Michael Wolfson, follow up if you would.
Well, the concern about healthcare I certainly share, and a wellness agenda. I guess, the different platforms have things for seniors in terms of income and in terms of home care, for example, but I don't see a more fundamental discussion about the fact that costs are, there are serious cost pressures. There's the intersection between home care and retirement income adequacy, and nobody's talking about that. Dr.
Forbes.
Well, like the two previous speakers, I agree that we haven't heard enough about health care. We really haven't heard anyone come out with an overall strategy, a national senior strategy, looking at wellness right through to end-of-life care. Given our aging population, we really need to be thinking about the whole spectrum, and we haven't really heard any of the politicians come out with a good national plan.
Adina LeBeau.
And going along with that, there's compassionate care, keeping older people in the workforce, but having something like maternity leave and compassionate care for the people who are going to need time off to care for significant others and family members in this aging population. So the workforce has to be tied in holistically to health care as well.
Now, I've left you for the end for obvious reasons here. You're the one ex-politician on this program who's actually who knows what it's like trying to get an issue on the agenda during an election campaign when the senior members of the campaign team actually have other things in mind. Yeah. So what did you want to see that isn't here, and why do you think we're not hearing about it? Well, I would certainly like to have seen a more fulsome discussion of the relations between the provinces and Ottawa on health care. It's plus ça change, plus c'est la même chose. I mean, it's 33 years or so since I was health minister, and the issues don't seem to go away. But I was also housing minister, and an issue that I've actually become involved in the campaign is trying to convince the federal parties to deal with the need to refurbish a lot of the public housing stock in this country. Most of it was built with federal and provincial money, but the federal and provincial governments are shying away from it and saying, no, the municipality is going to have to look after restoring 50, 60-year-old buildings. 25% of the people in public housing in Toronto, for example, are 59 years and older. And that's a big issue that needs to be addressed. Amy, if it's so blazingly obvious that all of these things are crucial issues, the clock is ticking, there's a demand by the public that these issues be solved, why do you think we're not hearing very much about them during this campaign?
Unfortunately, I think the campaign is really driven by sort of like a policy of fear, trying to rally the bases of each of the, of a particular political party. And I think there isn't a chance for the Canadians to be truly engaged in issues that are important to all of us, including healthcare. And I think it is really unfortunate that we are driven by this, discussions around issues that I don't think it's important to Canadians, such as, the niqab wearing. I think it is more important that Canadians be truly engaged in healthcare discussions, social determinants of health, housing, income adequacy, and of course, home care, caregiver support for seniors. Well, and I think Canadians want that.
Let's get a little more specific to that regard then. Cindy Forbes, the Canadian Medical Association, has got a strategy that it's putting forward right now. Let's put a few of the bullet points up, and then we'll ask you a little more about it. The CMA says $3.3 billion in the next year would help meet the immediate health needs of aging Canadians, a demographic top-up, you call it, to the Canada Health Transfer. That's the money the feds transfer to the provinces to help pay for health care and education and so on. Cover entire cost of meds when greater than $1,500 per year or 3% of annual income, and a refundable tax credit for caregivers. This is part of your, along with the Conference Board of Canada, I guess what you call the healthcare needs of Canada's aging population, a national strategy. Why those things? What's important about what you're suggesting?
Sure. Well, those three things are something that a new government could implement right away that would make a difference in the first few years. Some of the other things that I've alluded to in a national strategy would be much more long-term. But those three things, given the Canada Health Transfer top-up, we know that it costs more to look after an aging population, and we know our population in every province is aging. So that would make a difference if that was added to the formula that exists on a per capita basis. The other issue was the caregiver tax credit. Mm-hmm. There are about 8 million Canadians who are giving informal care to a loved one, to a family member, and with very little support. And that would be just one mechanism that would help support them financially.
What does the former health minister think about these ideas?
Well, things like tax credits, yes. I mean, the government could act on that fairly quickly, and in fact, I think something was mentioned about that in the last federal budget. But when it comes to dealing with pharmacare and other specifics, a very interesting book I read recently is Jeffrey Stevens' book, Condition Critical, I think was the title of it. And to my astonishment, he documents in his book.
I think you mean Simpson.
I just said Simpson.
Jeff Simpson from the Globe and Mail.
Sorry,
yep.
What did I say?
You said Jeff Stevens, who was part of the...
Oh, that's the difference, yeah, sorry.
Big Blue Machine days.
That's right, he was.
Yes.
But to my surprise, he documents that most of the $44 billion that was committed by the previous Liberal government in the early 2000s actually ended up going for higher physicians' compensation and higher wages, salaries, and benefits in the healthcare system. And most of it did not actually go towards adding programs, improving programs, and so forth. So most of what the CMA talks about, and I don't challenge any of it, is going to require some pretty detailed bargaining between the provinces who have the constitutional responsibility for healthcare and whoever is the federal health minister after the 19th.
Let's get Michael Wolfson and your view on what the CMA has on offer.
Well, I think it's really problematic for the CMA to be asking for another $3 billion. I think there's enough money, and there's a lot of people who've been saying this for quite a while, in the healthcare system. The trouble is it's badly managed. There's a lot of ineffective things going on, and it should be reallocated. For example, there's, I think, 15% or more of hospital beds are occupied by people who should be in nursing homes or receiving home care. If you're going to address that, one should be cutting the hospital budgets and moving the money over to various forms of long-term care. And another very good report recently is the Naylor report, and they document in there, for example, that most of the cost increases that have been going on as the CIHI are not due to the aging population. They're due to increases in physicians' salaries and the adoption of new technologies, including fancy new drugs, which we don't really do a good job of evaluating.
Adina LeBeau.
Yeah, I think, we have a challenge with the silos and the lack of integration and coordination of programs. many people are doing similar programs, and maybe doing them together would allow them to be done better and more effectively and evenly distributed across the system. It's almost like kids playing in the sandbox in different corners and not realizing the whole sandbox is ours. Let's play together in an efficient and effective way to do what we need to do to get the job done.
Dr. Forbes, there seems to be a suggestion of A, throwing good money after bad, which is what we're hearing from Michael Wolfson out of town. And, well, let's start with that. Sure. You've heard some of the criticisms. What do you say?
Well, I think to put it in perspective, the $3.3 billion is actually less than 2% of federal program spending. So I think that helps put it in perspective. But actually, a national strategy, I agree somewhat. We're not talking about more money. We're in the long run. We're talking about doing things differently. We have a healthcare system that was created 50 years ago. It no longer suits the population that it's meant to serve with more chronic diseases. So there needs to be a fundamental shift in the way we deliver care. But that's not going to happen overnight. So our proposal was really, in the short term, to maintain what we have right now, you know, with the changing of the Canada Health Transfer. We need that much more just to continue to do what we're doing now, and give us the time to make some of these changes that are going to take, you know, 5 to 10 years.
You look like you're champing at the bit to come back at that.
My point is the same as before, that even if they came up with the extra $3.3 billion on top of it, I think it's what, 6% is the going forward annual increase. Yes. Somebody's still going to have to sit down with the ministers from Newfoundland and Nunavut to say, now, how are you going to use your share of that? And they may very well say, well, that's all very well for you to say that, but we want it over here instead. And it's just part of the reality of the Canadian Federation and the issue, of course, I'm glad Professor Wolfson said what he did, because when I was health minister and president of the Hospital Association, I used to say regularly, we could spend the whole budget on healthcare. And the day after you committed the whole budget to healthcare, somebody would say, but you missed my favorite program. You didn't do this for my aged relative. It's one of those things that is never ending.
Amy, though, is there a recognition, do you think, among the political leaders at the moment who are out there stumping for votes, that the healthcare system in the country right now is going through one of its kind of historic transitions, and that they need to help do something about that? You're right, what you said off the top. We've heard precious little about healthcare during the campaign. Do they understand that they need to help kind of usher in this new era?
Because I think because they're not talking about it, so we really don't know how much they really understand. But I think from the grassroots, from the people that I work with on a day-to-day basis, we know how important it is. And I think that's why we need the politicians and the political parties to listen to, to the people on the ground, as well as of course, the seniors themselves, the people who are receiving care, the providers, as well as, of course, the federal and provincial governments all involved in this discussion. And I think what we really need is actually that leadership of that bold vision. That bold vision should not be driven by just an agenda that would last for like next 4 years after the election, but really should lay out in the longer term how we are not only providing care, but we're going to promote care and promote wellness. And I think, that kind of integrated approach around the whole sectors, not just health, but all the other, providers and all the other portfolios within the ministry needs to all work together. Because right now we're not seeing that kind of national leadership around, and Alzheimer's strategies and caregiver strategies and farmer care strategies, and all these would take a long time to implement, and I totally appreciate that, but we're not even hearing. So what's your vision? What's your key principles that would drive your agenda? And we're not hearing that.
Let me follow up with Adina, because Amy did mention a good list there of several compelling issues that we're not hearing much about that maybe we ought to be hearing more about. Let me add another one to that list. End-of-life care, physician-assisted suicide. Yeah. Two heavy things that I'm sure your members are talking a lot about.
Absolutely.
What do you want to hear on that?
Well, it's a quality of life, and it's the choice of the person and their doctor and their family. It's again, it's integrated into a continuum of personal care that goes from acute to ongoing to home care to long-term care, and in the end to palliative care. That's the evolution of a human being, and that's the process. And our medical strategies, policies at all the levels of government and all the players have to play into that. That is, you know, coming around again. It's the new old.
So then my question for the former politician is, are those issues too scary and controversial for anybody stumping for votes to talk about right now?
Absolutely.
They are.
I mean, it should be no surprise to anybody that nobody's getting up on a soapbox about the issue. I suspect that, in fact, the way this will be resolved is the way the abortion issue was resolved.
The courts?
The court has ruled, and I have a very strong suspicion that no matter who forms the government, that we've heard the end of it.
Amy, I hear you're trying to get in?
Yeah, I want to say that, you know, of course people are, like politicians, don't want to talk about end-of-life care. But if you ask the seniors that I work with on a day-to-day basis, they're not afraid of talking about end-of-life. In fact, end-of-life care is the most important issue is that quality of life. And I think the politicians always miss that point, you know, that in this healthcare discussions and even amongst the providers, you know, the problem I have is that we talk a lot about, you know, the medical, the treatment end of that. And we don't talk enough about quality of care and quality of life. And I think end-of-life care is more importantly, is a quality of life issue. And seniors are not afraid of talking about that. And politicians should not be concerned about talking about quality of life, because everybody wants that. And of course, end of life is, of course, that continuum. And I think that's what we're missing here, is that discussions around, you know, that all that continuum. Too much focus is on treatment, intervention of drugs, and not on, you know, quality, not on programmatic, non-pharmaceutical interventions, and also care provisions. And, you know, and all our research in healthcare also targets on all those, you know, treatment modality, and not on, you know, quality issues, not on prevention. And those, in fact, are more important to seniors.
Okay, let's get Dr. Forbes in.
Well, I agree with what Amy is saying, and I think another aspect of quality is also the quality of the care, where you're getting the care, where is the care taking place.
Meaning hospital or home
exactly.
or wherever.
And if I ask my patients, my senior patients, they certainly don't want to be in a hospital if they don't have to be, if they're not acutely ill. And, you know, 15% of hospital beds in Canada are occupied by mostly seniors who should be more appropriately receiving care either in the home or long-term care, but those supports aren't there. So I think that's a really important piece that hasn't been talked about as well. And I think if you ask seniors, they would tell you they want to stay in their homes and they want to get care in their own communities.
Yeah, for sure. Dennis Timbrell.
Well, when I became health minister, we were still under the original funding formula with Ottawa, where we sent literally boxcars full of paperwork to Tunney's Pasture every month.
Where's Tunney's Pasture?
In Ottawa.
Okay.
Ministry of Health, or Department of Health is up there. And in 77, 78, we switched over to the block funding model, and basically Ottawa said, look, okay, there's your money, you decide how to spend it. So we did. We introduced chronic home care, we introduced palliative care, we introduced a series of programs aimed at seniors and these kinds of issues. But at the end of the day, the problem with when we talk about what's focused on or not an election campaign, we are so driven now by 30-second clips on the nightly news or on the radio that it's almost impossible, even if the leaders wanted to get into these issues.
This is too complicated for a 10-second
to do so in
clip.
such a way that would do justice to the issue. And I would say to anybody listening, go to your local constituency debates. The candidates in your local constituency, they're given more time to actually speak to and develop issues on the local platform than the leaders. If you're really that concerned, go after your local candidates.
Adina, then Michael, please.
Yeah, I totally agree with what you're saying. You know, as part of the election discourse, we haven't heard anything about the boomers doubling the size of the demographic and their needs for health will double over the next 10 to 15 years. And if we're not managing now, and we're not setting a vision, a new vision for the increased stresses on the framework, then we're missing the target. This is what we have to be doing over the next 5 to 10 years, is setting the stage so that it can encompass and it can encompass from beginning to end quality of life and the evolution of the human being going through the system.
Michael Wolfson.
I get tired about hearing this business about the boomers. You know, I'm on the leading edge of the baby boom cohort, and I'm pretty healthy. And when we look at the data, the boomers aren't going to be, the leading edge isn't going to be turning 75 or 80, 85 when the healthcare needs really start to increase for another 15 or 20 years. So the need to panic because of what some people, I call it demo doom, I think is overstated. But I'd like to return, you know, to a couple earlier points. The point about quality was raised, and I think it's really important in the context of end-of-life care, palliative care. But there's an old line, you get what you measure and you can't manage what you don't measure. And there is a pervasive problem in our healthcare system that we don't measure healthcare outcomes in any systematic or rigorous way. It's a complete mess from an information point of view. By the way, I spent a couple decades at StatCan trying to do this. So it's not surprising that we can't figure out, you know, when it comes time to squeeze the healthcare budget, you get across-the-board cuts rather than things that cut out the procedures or things that are ineffective. Another point, I think it was Amy Go was raising about the broader determinants of health and well-being. This is fundamentally important. It's not very popular or noticed at all in the current political discussion, but I would like to use it to bring back another point which I raised at the beginning, which is I hear nothing about the intersection of expanding the Canada Pension Plan, for example, and the relationship to long-term care and home care. Given the kinds of fiscal pressures that are being faced by the provinces, it's unlikely that 100% first dollar coverage is going to happen for all of those things in the next 20 or 30 years. So it really is important to try to understand the interrelationship of retirement income adequacy and what people are going to be having to pay for out of pocket to an increasing degree over the next 10, 20, 25 years for these currently uninsured or only partially covered services.
Okay, Adina, I know you want to get in, but hold that thought because this is a great segue to actually your Action on Seniors Poverty study just out. Let's bring up the bullet points on this CARP study, shall we hear? This is the empty nest egg. More than 600,000 seniors in Canada live in poverty. That's 12% of all seniors. 1 in 4 single seniors lives in poverty, and most of them are women. There are 12 million working Canadians, 2/3 of all workers who do not have workplace pension plans. Projections show that approximately half of Canadians will encounter a 25% decline in their standard of living once they retire, and 44% of caregivers are over the age of 45 years old. These are all from CARP's Action on Seniors Poverty study. Let's unpack this a bit, shall we, Adina? Why do you think there's so many Canadians struggling to make ends meet in their later years?
Oh, well, like we just learned, 66% don't have industrial pensions. If you take a look at OAS and CPP, maybe an average of $1,000 a month doesn't even get your rent in downtown Toronto, let alone in other cities across the province. People are being pushed out of the labor force, the workforce, you know, at 65, when in fact some people are going to have to work much, much longer for at least another 10, 15, 20 years in order to keep a roof over their head and contribute to the social safety net that we have constructed at all levels of government so as not to impact our children and grandchildren. And this is where, you know, I want to just sort of head back to what Michael was saying. It's not the panic. It's now's the time to take a look at the vision and the planning and the working towards the model that we want to be intact and in place when that happens.
And when that happens is what? Are we talking 10 years down the road when we need it to be in place?
10, 15
okay.
years. I mean, you know, at older ages, seniors start using the healthcare system more. Everything's replaceable. We have new medical technologies that are keeping people alive much longer and in healthy and active lives. But that also has its own stresses on the system.
Sure. Let me ask Dennis Timbrell this question. There are numerous savings vehicles out there for people to save for their latter years.
Yes.
And tons of unfilled, right? I mean, not very many people top up their RSPs in ways that they can. Why are they not saving adequately for their futures?
I really am not sure I can answer that, because it depends on the individual lifestyle. I'm a boomer, probably about the same vintage as Michael, and buying a new car every 2 or 3 years was de rigueur. You know, getting a bigger house, a better house, a cottage, a better cottage, and so forth was, lower interest rates certainly haven't done anything except encourage more spending. But you know, I remember when CPP came in, and this was great. This was going to, because I was 20 when it came in. This is going to be wonderful. Well, the CPP really isn't doing very much for us, any more than I think the provincial plan that's put forward in Ontario is going to do very much for us in 40 years. Because if you look at the projected payouts and look at them as net present values, which Professor Wolfson may have done, it's not a huge amount of money. So it's still going to come back on the individual to take responsibility for saving and putting money aside regularly for later years.
Amy, I hear you.
Yes. So, you know, I'm sure Avi actually on the show has talked about the racialization of poverty. So I just want to echo, you know, COP's study of poverty among seniors, and also sort of dovetail that with the studies around the racialization of poverty and the widening gap between the rich and poor. And we know that actually amongst people who are lower income, disproportionately those are people of racialized background, people of color, immigrants, visible minorities. So, you know, I'm sure that the COP study probably would show the same picture. So, I mean, these are people who are already at the low income jobs, and where's the saving for them when they are just sort of meeting their day-to-day, or not even enough to meet their day-to-day needs. And you know, and these are the cohort who are going into the senior years with no savings and no support network. So you know, when we're talking about income support, we should be talking about the whole, even the current pictures around how do we address the inequities in our system amongst, you know, the widening the gap in the rich and the poor, and to address that. And of course, when we look at the seniors, the gap between the rich and the poor seniors, and how do we support that? Having, of course, a pension plan is great for these seniors, but unfortunately, we all know that many of them are working at those, like, you know, sort of Chinese restaurants or low-paying service industries, or, you know, and because we know that manufacturing jobs are, you know, we're losing tremendously in Canada of those.
Okay, I got Cindy Forbes trying to get in here, Amy. Yes. Stand by. Go ahead, Amy.
I wanted to respond to the point made about you know, not panicking, and I agree we shouldn't panic, but I would also like to point out that, you know, as a family physician, I'm very aware of the stresses on our system right now. And we know that is not going to get better. It's only going to get worse if we don't do things differently. The other point I want to make is that every province and territory are trying to figure this out on their own. And there are pockets of excellence across the country that we could share and scale up. And really, this is about federal leadership, about having a Canadian healthcare system that people feel really strongly about. And physicians are very passionate about this issue right now because we're working in the system every day and we can see what's coming.
Let me ask Michael Wolfson if he feels strongly about the following Conservative government policy, which is to push back receiving old age security from the age of 65 to 67 in future years. What's your take on that?
It turns out I had the opportunity ages ago to work in the Department of Finance on a study, a white paper on retirement income policy. And at that time we said the population is, this was 30 years ago, 40 years ago, the population is aging. We should be thinking about raising the age of entitlement. And the US had done it about that time, but they gave 20 years of lead time and phased it in over 20 years for the Social Security system. In this case, I can't believe what the Harper government did, because they raised the age of entitlement of the wrong thing. You know, GIS, the Guaranteed Income Supplement, is targeted to the poorest of seniors. I would assume they didn't bother proposing doing it with the Canada Pension Plan, because that would, is like the Constitution, it would have required federal provincial agreement according to an amending formula. But the broader point is we are living longer. We should, many people would like to work longer. On the other hand, there should be flexibility so that people, who either because of their own ill health or a significant other's poor health or because they just can't get back in the labor market, should be able to start receiving a pension at an earlier age. This is, as somebody was earlier saying, this stuff takes more than a 10-second or 30-second soundbite to discuss. So, I remain continually frustrated that people don't want to discuss it at all. But having a more flexible, but at the same time, retirement income system that looks after poor seniors, but at the same time gradually raises the age of entitlement. By the way, in my view, that would be a quid pro quo for enriching the Canada Pension Plan and phasing it in quickly enough that it will actually benefit at least the trailing edge of the baby boom, and people wouldn't have to wait half a century for the benefits to be fully realized.
Let the record show none of the answers on this program so far has been 10 to 30 seconds. We let you finish your sentences on this program. Adina, you wanted to follow up on that.
Well, I was just going to add, it's just so holistic. I mean, we're talking about a national health care strategy, but we need to talk about a national job strategy, not just keeping older workers in the workforce longer, but our kids and our grandkids getting their jobs and getting a good start in life as well. It's tied in. We're talking about a national senior strategy and a national pharmacare strategy and a national housing strategy. This is all the social determinants of health.
Let me pick up on that, on the housing angle. Because you're an ex-Conservative cabinet minister, Alvin Curling, an ex-Liberal cabinet minister. The two of you have put this, task force together trying to get public housing on the agenda?
Add to that David Warner, the former NDP Speaker of the House. The three of us are promoting a program called Stand Up for Public Housing, specifically looking at the need to make some major repairs and to avoid having to close down thousands of units. I'm talking just now in terms of Toronto stats. Nationally, it would be tens of thousands of units that are going to have to be boarded up if they aren't properly repaired. And
where's the political will to do any of this?
Well, in Toronto, the City Council, bless their little heads, actually stepped up and 2 years ago did commit almost $1 billion over 10 years for this purpose. And so what we're doing is we're going after the federal candidates and we're going after the provincial premiers and their ministers to say, when we were ministers of housing, the provinces and the feds looked after housing. They've both walked away from it, and it's time to come back to the table, and specifically to address this particular issue, which, again, tying it back to seniors, 25%, which I think I said earlier, of the tenants among the 60,000 assisted housing units in Toronto are seniors.
Michael Wilson, there's a finite amount of money to go around, obviously, for all of the things that everybody wants to see done. But how do you want to break up your dollar? When you spend your dollar on all of the worthy things, the worthy ideas that have come forward on the program so far, how do you want to divvy up that dollar if you're in charge of it?
Whoa. Well, the first thing is I wouldn't put any more money into healthcare because I think there's enough money there now. In fact, Canada's at the high end in OECD rankings in terms of spending and at the low end in terms of results. So figuring out how to reallocate within healthcare would be a good thing. The finite amount of money, in my view, is the whole economy. It's not just what government revenues are. So increasing the premiums in order to fund an expansion of retirement income, for example, in the Ontario plan or an enlarged Canada Pension Plan, seems to me eminently reasonable. As I said, there's a bit of a quid pro quo in terms of raising the age of entitlement in exchange for faster phase-in, I think would be a good idea. I don't have strong views on housing. There's clearly important things to do there, but in terms of how much money to put here or there, I wouldn't say. But if I can just take another couple seconds and come back to the question you asked Mr. Timbrell about why aren't people saving enough for retirement. I think the question is often phrased as, well, why it's individual responsibility. Why aren't you doing something about it? But when people take out a mortgage, they pre-commit themselves to make those monthly mortgage payments. When they accept employment in one of the decreasing number of workplaces that have a pension plan, they don't say, I don't want to pay for my pension plan. It comes off the top of their paycheck. And I think we don't give Canadians enough credit for the possibility of saying, look, I want to pre-commit the first tranche of my weekly or fortnightly paycheck to make sure I have income in retirement. So yes, I will vote for a government that's going to arrange that for me through an expanded Canada pension plan, for example. So I wouldn't treat the provincial budget or the federal government budget as fixed. It's a matter of where you want to raise taxes, cut back tax breaks. You know, as a number of the parties have said, there's a number of important tax expenditures
Gotcha.
that really don't do much good.
I got a minute left here. Let's give 30 to you and 30 to you.
One of my concerns is the revolving door on the minister's office at Queen's Park. I was the 13th Minister of Health. From 1924 to 1982, I was the 13th Minister of Health. The current minister is my 17th successor in 33 years.
The average is what, 2 years they have
Well,
a
it's
job.
got to the point that one former hospital CEO said when he sends a letter to the Minister of Health, he addresses it to dear occupant because he doesn't know who's going to be there. So there needs to be some continuity in the leadership of the provincial ministry. I can only speak for Ontario. I can't speak for Nova Scotia or others, but I'm sure it's the same thing. And see them through a long-term agenda.
Adina.
Well, things have changed since I got my first job and started saving. Interest rates have gone down. Life expectancy has gone up. And in order to carry my weight in society, I have to keep working. And I'm quite prepared to keep working and continue supporting our social safety net on the behalf of my children and grandchildren to do it, and looking for Canada to allow me to do it.
Your children and grandchildren will be thrilled to hear you say that, I'm sure. Amy and Michael, thank you for being there on the line for us in New York City and Ottawa, and to our guests here in studio as well, Cindy Forbes, Adina LeBeau, Dennis Timbrell. Great to have you alongside as well.
Thank you.
Thank you.
Help TVO create a better world through the power of learning. Visit supporttvo.org and make a tax-deductible donation today.